I guess there she goes. All right. So thank you very much, Claudia. Okay, so we're officially recording, and so we'll get started with the webinar. Again, thanks for joining today. Our topic is pregnancy and infant loss, what comes after. We will have two segments of this webinar. Our main presenter, Liz Krey, she's an IBCLC, and the second portion is Karrie Escobar, who will share her personal story of loss. And I am honored to have the opportunity to introduce our main presenter this morning, Liz Krey. She's a single mom of two boys, aged 8 and 5. Since the birth of her first son, Liz has been passionate about breastfeeding. Her own journey was not too difficult, but she quickly realized the lack of standardized care for lactating parents and the confusing amount of contradicting information. She started attending the Leche League meetings and has been a leader there for 5 years. And from there, she escalated her education to be an IBCLC. And she now works for WIC as a lactation coordinator, where she hopes to make a wide impact on the county and help parents meet their breastfeeding goals. So without further ado, I will give Liz the mic. Thank you, Liz.
Thank you, Sarah. That was lovely. Appreciate the introduction. And hello, everyone, and happy Valentine's Day. I'm greatly appreciative for all of you who decided to spend your lunch with us today. Let me go ahead and get my PowerPoint all set up. Alrighty, can we see that? I can't see nods, so if I could get a verbal.
Yes, we can see it, and it's starting to render, so it's getting clear. Yeah, we're good.
Okay, perfect. So yes, this topic is about pregnancy and infant loss and what comes after. So before we begin, there are some disclosures that I'll be making. I have nothing to disclose. I have no financial ties to anybody. The information presented today reflects only my own thoughts, opinions, and experience, and should not be taken as a reflection of my employer or any healthcare provider. I would like to take a moment to recognize the land that I currently reside on. I'm on the land of the Yokuts. This information can be very helpful as care providers in helping us remember the wide variety of people that we serve. It's not just the participants that we might see every day, it's also the people who don't have access to care because they lack transportation, money, education. So it's really important to keep those who are not able to see us in mind as well. I also will be using inclusive language throughout this presentation. I do sometimes use the word mother, but for the most part, I do say parents. I find that this can be helpful in expanding the use of this information. Instead of just being for parents, it could also be for grandparents, uncles, aunts, any sort of care provider like that. And I also encourage everyone to take care of yourselves. This topic can be very difficult, very challenging, very hard. So I welcome you to step away for a few minutes if you need to, or to just be done with it for today and watch the recording later when you might feel a little bit more prepared for the information. So with that said, our agenda today is pretty straightforward. I will be going over our objectives as well as our role as care providers and how we can support families who have lost either infants or their pregnancy. Then we'll be moving into making milk after a loss and what that can look like, as well as reentering society, because it can be very hard going back to work when you left, perhaps pregnant, and came back with no baby. That can be a very hard transition to make, and so I'll be giving some suggestions on how to do that. I'll also be giving some resources, local, online, and books. So you can have resources no matter where you are in the country. And then we will hear the personal story of Karrie Escobar. And she will be giving us her story of what happened to her and how she managed to make it out the other side. So our objectives today are to learn how to support grieving families with compassion and humanity. Also to teach families how to manage their milk after loss and inform families about their rights and how to set boundaries when returning to work and society as a whole. And finally, we'll discover local resources to share with families. And as I said, there's going to be some books as well, so it will also be non-local resources. I'll take a moment here. If you were not able to click on the link in the chat, this QR code will bring you to the form to fill out for your continuing education units. So I'll just linger here for about 30 seconds. If you need to grab your phone real quick, just scan it with your camera and it brings you to it real quick.
And I put the link in the chat again for those that came in a little later. So that link will take you to the same place to confirm your attendance. Thank you so much.
Thank you, Sarah. Okay. So our role as care providers can vary widely depending on what your specialization is. But one thing that we do all have in common is that we are charged to support and inform our participants. And as care providers, we do play a critical role with helping a family, right as either they learn the information that they might be miscarrying, or they just had their miscarriage, or they just lost their infant. Regardless of what stage of loss, we are very important people to the families that have lost. We can provide technical information about what is happening, because sometimes families don't know exactly what's happening. So it is up to us to provide accurate information about the changes to the body and what to expect in the next few days and weeks. But it's also up to us to provide a safe space for them to ask difficult questions. Cultivating a safe space is not something that you can do instantly or overnight. It's really the way that you approach helping families and participants. Providing a safe space is not something that I can really go into depth right now in this presentation, but I will say that remaining empathetic, open, and meeting your participants where they are and not expecting them to be ahead or behind, just meeting them exactly where they are and helping them meet their short-term goals is a great step in creating a safe space that allows them to ask the difficult questions that a lot of people have, but don't feel like they can ask. It's also not our place to judge. It is only our place to inform. We know nothing about the families that come and seek care for us, except for what we have in that moment. We don't know where they've been. We don't know their life story. We don't know their history. We don't know why they make choices. Only the family knows that. So we have no room to judge them. But we do have room to inform them and help them create a path forward that feels natural to them. In doing so, it's important to remain human and not turn off the emotion. It can be a little comforting for care providers to fall back on the clinical language, because that removes the emotion out of it as it is. It's really standard and to the point and quick. But that's not really what the families need from us. It can leave the parent feeling upset or like feeling not fully supportive. It can be very difficult trying to walk into your office knowing that you have a family that's grieving. It can be hard to want to go in there and to feel all of the emotion and the stress that can come up. So finding that balance of remaining empathetic but not letting your emotions take over you is something that I've worked a long time to try to figure out, and it's still a work in progress. So that's something that will always be a skill to build on. Some things that you can use while you're trying to figure out this delicate balance is to just empower them and use encouraging language, such as, no one prepared you for what you just went through. Our prenatal classes that we take standard don't really go into miscarriage, because obviously that would be a very upsetting subject to be talking about to a bunch of pregnant people. So most people are not informed on what they need to do or what might be happening to their body. So acknowledging that they were not prepared is a great way to recognize where they are. That's what I mean when I say meeting them where they are. Like, no one prepared them. They don't know. They don't know. So recognizing that can really build that rapport between you all. You could also recognize the simple fact that no matter how far along in that pregnancy that parent was, you could say that you gave birth today. The outcome is not what you wished for, but your baby was. It's very rare for a parent who has miscarried to hear the words that I gave birth. You know, when you give birth to a normal, healthy, full-term infant, you hear that all the time. Like, oh, you gave birth, and that's great and beautiful and wonderful. But the parents who miscarry don't really get that same acknowledgement as those who have not had a miscarriage does. And if you're really stuck and you really don't know what to say, then it is okay to say nothing. Just being present and holding the space for the participant to share their feelings, their thoughts, their concerns, and just saying nothing can really let the time and space be about the participants and not so much about you trying to manage the situation. So moving on are some things to avoid saying. One of the big ones to avoid saying is saying that this is common. While it is true that miscarriage does happen in about 1/4 of the women, it's not common to that particular parent. You know, it can be very dismissive and it's not common to her. And right now is not really a time to be giving her that fact that it's 25% of women do experience a miscarriage. Like that's not the time for that kind of information. Saying things like, I understand your pain. Unless you've experienced a loss like this, you don't understand it. Losing a pet or anything, or even losing a parent is not quite the same as losing an infant or a child. So just try to avoid saying things like that. It comes from a place of empathy, like you're trying to connect with the person you're talking to, but it can kind of shift the spotlight away from them and kind of bring it back onto you when it's really, this is their journey and it's not really about you right now. So try to avoid saying things along those lines. The last thing I'll say on the slide is that everything happens for a reason. That can be a very touchy line for some people. Not everyone believes that everything happens for a reason. And if they do believe that, then it can really spiral them into a downward negative thought pattern. Well, if everything happens for a reason, then I must have done something to make it happen, right? Well, maybe if I would have slept an extra hour, or, you know, like what if, it can really spiral them into some very dark places. So lines like this might be better a little bit after the fact and not so immediate. And especially if you have a rapport with that person, it might be okay to explore this topic. But if you don't know the participant or patient at all, or if you are not certain about their thought process or anything, just try to avoid saying things like that. But one thing that I do want to point out is that, as I was saying, it can be very difficult to give yourself that pep talk, to go into your office and sit down with someone who's just had a miscarriage. It's very difficult to have to listen to that and process it and help them move forward. It's very stressful. It's very draining on us as care providers. But I encourage you to kind of shift your thought pattern. You get to be the one to help this family and this parent to acknowledge and prepare them for the rest of their journey. So while yes, it is hard and it is draining and you might not want to do it, you get to be the one to help them. You get to give them the resources. You get to help them be heard. You get to answer their questions. So kind of, this can take a long time to really fully settle in yourself. And it's something that I'm still practicing as well. I get to be the one to help this family today. So if nothing else out of this presentation, I hope that this one slide will stick in your mind because it is a great starting point in the rest of this presentation. So milk making after loss is something that is also not commonly considered until it happens to you. So how do we manage lactation after a loss? Many parents don't consider that their bodies will make milk if the loss is after about 16 or so weeks of gestation. This is a little tidbit of information that I feel like should be standard in a lot of prenatal classes. I feel like it is probably common, but it should be standard across the board that this information is out there. So that way, if people do lose their babies after 16 weeks, then they at least have that thought in their mind that, oh, I'm going to have to deal with my milk. And it won't be such a shock like, oh, there's milk? What do you mean? And now I have to make another choice on top of this terrible life experience. That can be very difficult. So if they have that little bit of knowledge just in their head, it can make making choices slightly easier. So again, it's important to remain gentle but informative, telling her that you are still a mother, and like any mother, your milk will be present. Are you open to me showing you how to hand express? If you'll notice, this question is definitely leaving it up to the parent. I'm not pushing it. I'm not saying, okay, it's time to hand express now. Are you okay with that? We're not pushing anything. We're just making options available. But we're also letting her know that your baby is not able to move your milk. So it's up to you to move it in order to avoid mastitis or engorgement or things along those lines. Like, we're gently informing her, but we're not pressuring her into any sort of decision. If she does make the choice to express her milk, it can be very emotional, and offering to be present with her while she's expressing her milk for the first time after her loss can be critical to her continued success. Again, like I mentioned before, if you're not sure what to say, just being present in the room with her, sharing this moment in time with her. She's moving her milk that was supposed to be for her baby, but her baby's not here anymore. And so it can be for some, it can be a soothing experience to pump milk, even though their baby is not here. And for others, it can be heartbreaking to do that. So it's important to be aware of the wide range of responses that you might get from parents. And some parents might ask, well, what do you even do with all of that milk? Why would I pump my milk if my baby's not here? So some things that we can do with that milk is, of course, we can donate it to milk banks. There's 2 here in California, in San Jose and in San Diego. And the vast majority of that milk goes to preemie babies and NICUs. So letting her know that her precious milk can go to these highly at-risk infants can help ease some of that emotional pain. And if she's so inclined, she could be thinking along the lines of like, well, if my baby can't use it, then at least I'm helping another baby get the best start to their life. If they're not interested in pumping to donate, they can pump just a little tiny, like just an ounce or so of colostrum, and you can make breastfeeding keepsakes. These can include necklaces, mantelpieces, earrings, bracelets, little statues. There's a wide range of things that can be made out of breast milk, and it can be a little memorial to the baby that they lost. And then it is up to the parent how long they pump. It was not up to the parent. It was not their choice to lose their baby, but now it is their choice on what they want to do with their milk. They can pump for a long time, they can pump for a moment, or they can not pump at all. And all of those options and everything in between is perfectly acceptable and okay. And we can support the parent in whatever choice that they make. If you're not a lactation professional and you have a parent who wants to pump for milk banks or has any sort of questions, I would highly encourage you to get them into contact with a lactation professional, like a lactation consultant or CLC. So that way we can help the mom get a comfortable pumping experience, because they will run into the same challenges as any pumping parent. So after figuring out what you're going to do with your milk, now you have to re-enter society after losing your baby. And that can be incredibly challenging. People will want to know. People will have questions for you and will want to know your story. And so we're going to go over some of the legal rights and some tips on how to set boundaries around this kind of information. So first and foremost, their rights. The information surrounding pregnancy, birth, and loss are all protected medical information. You are not required to share any of it, and it is up to personal discretion on how much you do choose to share. With that in mind, sharing some details might make it easier to get accommodations, like if you're pumping or if you need to leave work a couple of times a week to do follow-up appointments or things along those lines, but it is also not necessary. You can just say, I need Tuesday off, and that's it. An employer, again, might ask for more details on why you need Tuesday off, but you don't have to tell them that it's for a follow-up appointment or anything. It's not required to divulge your personal medical information. If the participant or parent chooses to pump for milk banks, they are entitled to pumping breaks just like any other lactating parent. And just like any other lactating parent, they can have as much time to pump as they and their employers agree on, but it will likely be unpaid if it falls out of normal break times. Excuse me. However, there was a new law that was just passed called the Pump Act. And the language in it is a little bit tricky, but the gist of it is that if you're working while you're pumping, so if you're doing emails or filling out a report or whatever while you're pumping, you're entitled to minimum wage pay while you're doing that. So that is definitely something to keep in mind and to bring up to HR for any sort of pumping lactating parent, but it is especially critical for those who have lost, because they will likely have lost out on paid work days, and having that pay while they're pumping can be a nice little bonus. This parent's need to pump milk is just as valid as anyone else's up to 1 year postpartum. A lot of parents who do choose to pump can feel a little bit guilty, like, oh, I'm getting this break time to pump milk, but it's not even for my baby. And, you know, like it can really easily get inside their head. So it's important to be aware that they are entitled to those pump breaks. And if they don't get those pump breaks, they still get mastitis, they still get engorgement, they can still suffer loss of supply. And that can also be triggering to the parent too. If they're pumping and they have a great supply and they're donating to either the milk banks or to a local mom, and that baby is relying on her to pump the milk and she doesn't get her break time, that can cause a lot of trauma and stress on that parent as well. So it's very important to remember that no matter who's pumping and for why, they are protected under the law. So as you re-enter society after losing a child or an infant or pregnancy, many people will be curious about what happened, and some will have good intentions and others will not. It is your story to tell, or not. You know, as I've said multiple times, it was not the parent's choice to lose their baby, but now they do have a choice. They can choose what they want to share, how much to share, with whom, and why. It is important to remember, though, that many will not understand or be empathetic. Like I just mentioned about the guilt of that parent pumping, like, well, why do I get extra break times? Coworkers might have that thought too. Oh, well, she's pumping and she doesn't even have her own baby. Why should she get the time off? It's not the job of the grieving parent to change the other employee's mind. It's up to the supervisors and managers or any sort of higher supervising staff to be aware of any tensions that can arise and work to ease it quickly, while supporting the grieving parent as much as possible and providing education to the staff if necessary. Because often the people who do not understand why this pumping parent needs her breaks are just, they don't have the education, they don't have the information needed And they're coming just from a place of ignorance. And it's our job as supervisors and care providers and leaders to work to educate that person gently, like they don't know what they don't know. But it's not up to the grieving parent to do all of that work. It's not up to the grieving parent to have to go to their supervisor and be like, hey, person next door keeps giving me a hard time because I'm trying to pump. Ideally, we should be on top of that and have our eyes out for that and try to solve it before it becomes a problem. Because that grieving parent already has so much on their plate that now putting workplace tensions on it will likely not go over very well. Some other options while you try to re-enter society are counseling and antidepressants. Counseling and speaking to a psychiatrist or psychologist or behavioral therapist can really help you sort through tough feelings, the disappointment, the anger, the grief, the sadness that comes along with losing an infant or having a miscarriage. And for some, that might be enough. It might be enough to just talk through their grief and figure out coping strategies for when the feelings get too much. But for others, antidepressants have been very helpful to them. Again, it's important to talk to your doctor and psychologists and make sure that you guys are all on the same page, especially if you're pumping. There are some antidepressants that you can take while you're pumping, and it won't affect the milk. But there are some that will affect the milk. So it's important to have that open conversation with your care providers. But antidepressants can be very helpful for families who are experiencing a lot of other tensions in their life, like perhaps they have other children that still need to be taken care of. Elderly parents, they have to work 2 jobs to pay the bills. Like life doesn't stop just because you've lost your pregnancy. And so the antidepressants can allow someone to have the energy and the ability to go through their day-to-day life without having depression hanging over their heads. The last option that I have up here is not viable for quite a lot of people, unfortunately, but taking a break if you can, putting work or school obligations on the back burner while you and your family spend time healing can go a long way in finding your new normal after losing your infant. But as I said, life doesn't stop just because you've lost a child, and it can be impossible to take this break. But if you are able, if you have the means, if you're able to pull out a savings, if you have family members who can float you for a little while, anything, even a short 1-week break can really make a difference in the parent's own well-being and how they want to present themselves to the world now and what they want to say to their friends and coworkers. So this line gets me every time, and I've read it like 75 times by now, but your love for your baby, you will love your baby until the end of time, and nothing can take that away. And this is true if you miscarried right after conception, or if you've lost your 30-year-old child. You will love your baby until the end of time, and nothing can take that away. And I feel like this is a very inspiring quote. Maybe give a little bit of peace to those who might be having a hard time after losing their child. Nothing can take away the love for that baby. Sorry. So I will be wrapping up my portion here with just some resources for you and your participants and families, where you can find more information about miscarriage, how to handle it, things that you can do and say for those people who have lost. So these are some websites and some local in-person support. So this will be local to Tulare County in California. But Still Birthday, you can reach from anywhere. Stillbirthday.com offers a lot of resources dedicated to bereavement doulas, including ideas on how to celebrate the baby and creating connections to others who have walked a similar path. One idea that they have on there for those who are religiously inclined is to write everyone who's involved with the baby, parents, grandparents, aunts, uncles, whomever, they can all write a letter to the baby about their hopes and dreams that they thought that they would get to have with that baby. You can fold it up, put it in a fire safe bowl, and you can light it on fire, and the smoke will bring the message up into heaven, and your baby will get your message. So that's just one little idea to celebrate the baby that they have on there, but they have many others that are also not religious. But I just wanted to share one of those, so that way if you do have a participant or parent or someone who's grieving, maybe you can suggest that to them and maybe that might help them. So next up is A Legacy of Love, which is a local group led by a postpartum nurse who's lost her infant. They have a Facebook page. When we send out the slides, you can click on it through here, or you can Google A Legacy of Love, and you can get connected to them through there. I don't know if they're having in-person meetups yet or not, but that is something that you can find out by going to their website. Our third resource is going to be Project L'Oreal. It's a nonprofit that offers comfort, hope, and healing through custom-made memory boxes to families who have dealt with infant loss. So these are very beautifully made boxes that you can place the baby in for memorial pictures or things along those lines. Again, if you wait for the slide, you can click the link through the slide, or you can just Google Project L'Oreal and it should come up pretty quickly for you. My last slide of resources here are just some books that it spans the gamut. It has a guide for fathers, it has for miscarriage, it has for those who have lost infants. The one at the bottom, 3-1, Stories of Parents, Love, and Loss, is a collection of art from parents who have lost. It includes poems, pictures, stories, things along those lines. So it's a very big collection of artwork dedicated to those who have experienced loss like that. So I just wanted to point that one out in particular. But all of these are available on Amazon, or you could check your local library. As care providers, I would encourage you to go to your library and ask for some of these to be on hand. And then I would also purchase a couple of them for yourself if you often have grieving parents in your office. Some of these books, having them actually with you and actually able to give them to the parents can be one less thing that they have to worry about. And now they have this book that can perhaps give them some comfort. So wrapping up my part of this presentation, navigating life during and after a loss can be incredibly heartbreaking and challenging. With the right information and compassionate language, we as healthcare providers can support these families and help them onto a path of healing. We can also share our own stories to let those in the middle of their grief know that they are not alone and that there are places for them to turn to. So now we will be moving into the personal story of Karrie Escobar, and Sarah will be introducing her while I get this video set. So give us just a moment, please.
Thank you, Liz. So let's see. Okay, one second. I thought I had the slides up, but I don't. Can you share
I
your
can,
slides again?
yeah,
quick?
absolutely.
Okay.
Sorry about that.
No, it's all good. Okay. I'm going to introduce Karrie. Karrie Escobar. She was born and raised in the Central Valley. She's a realtor, preschool teacher, and mom, now living in Portland, Oregon area, and she has graciously offered to share her story. Liz, you can take down that slide. Thank you. I just wanted to read that out loud. So Karrie is daughter of Carmen Escobar, who's with us today, and she's going to close us out. But unfortunately, Karrie, she's working 2 jobs now, and they were, she didn't have both jobs when she agreed to share her story. And so unfortunately, she couldn't be here today. She wanted to so bad. So we made a compromise, and she did a video and she sent that over, but she just a beautiful soul, and I really hope you all enjoy.
All right, let me just make sure I have sound. Okay. And please feel free to turn up your own computer volume. It might be a little bit quiet. I have mine all the way maxed up, but just letting you know that feel free to turn up your computer volume if it's a little bit quiet. But here we go.
Hi everybody, my name is Karrie Escobar. I am a Portland area realtor, preschool teacher, and mom. I did grow up in the Central Valley. Carmen Escobar, she's here somewhere. She is my mom, and she reached out to me to see if I would be interested in sharing my story about pregnancy loss. This is something that has shaped my life so much. And one of the things that I've realized is it's something obviously very difficult to go through, and I've realized it can be such a blessing to share with other people, especially a topic that a lot of people really aren't comfortable talking about. And so I take it upon myself to talk about it as much as I can, to be open about it. And yeah, so I'll just be sharing my story and just talking about what has helped me go through this time in my life. So I have a 4-year-old daughter, and she is amazing. Prior to having her, I had 2 chemical pregnancies. For me, it felt the same kind of loss as a miscarriage. A chemical pregnancy, if you're not aware of that term, it's basically just a very, very early miscarriage, where there was no implantation, it was just chemicals. But for me, seeing that positive pregnancy sign, the positive pregnancy test, was life-changing and something that I was really hoping for. And so to lose 2 pregnancies, when I really hadn't truly considered the possibility of losing a pregnancy. And I think a lot of people really can't even consider that possibility, or even consider how common it is when you first find out that you're pregnant. So for me, I had 2 chemical pregnancies, and that, like I said, felt like just like any other loss. And for me, it didn't make it any less of a loss just because it was super early. And so the first point that I want to say, whether you've experienced pregnancy loss, infant loss, child loss, a loss is a loss, no matter how long you had that life in your life. Whether it was a week, a year, whatever time frame that you had that child in your life, it's still a loss. And I just want to recognize that first. So 2 losses. I had my daughter, and then earlier last year, I had another miscarriage. It was later on, and I can confirm that it emotionally felt the same as my 2 chemical pregnancies. Physically was much harder, but we're not going to get into that. But it was very difficult. That was very difficult. It's also much more fresh. It happened much more recently, and I feel like just the way that it happened, it was a miscarriage. So I went in for an ultrasound after having I had an ultrasound early on in the pregnancy. Everything looked great. Went in a few weeks later for another ultrasound, and we found out that there was no heartbeat. And so just that waiting period of, how was this miscarriage actually going to take place, and all of that. It was very, very difficult. And as difficult as it was, going through this 2 different times, I've had 2 very different experiences in healing. My first experience, I think in the moment that it was happening and physically when it was happening, it was easier. But healing from that was so much more difficult than healing after this last time. So I'm really excited to share just kind of those things that really made a difference in healing. So there are several things that really made such a big difference between the first 2 losses and this most recent loss. The first thing is support. When I had my 2 chemical pregnancies, I had just moved to a different state, a new state, new city. I didn't know anybody. And a couple months after moving there is when I experienced those losses. And so it was really difficult, without friends or family going through that. I also was married to somebody who was abusive, and that was very difficult. When you're, another story for another time, but when you're in a relationship that's abusive, oftentimes you don't realize how hard it is or how bad it is until you can look back in retrospect and see just how difficult the situation was. And so it's definitely one of those things that I can see now that really played into how, just how difficult that was and how that played into my healing journey. Now I'm living in Portland, Oregon, and I have the most amazing group of friends, and I have a really amazing husband, different person, not the same guy, but I have a really amazing husband who is incredibly supportive. And it is just so amazing to have people that, even when there's really nothing to say, when something so difficult happens, what can you say? There's really nothing that anybody can say that will make it feel any better. And one of the things that I've realized is I don't need anybody to say anything. I just need people to be there with me and be there for me. And so, I've had times where I'm, sobbing, or I'm just speaking about how I'm feeling, and it's really difficult things to feel and to hear. But my husband and my friends are just there for it. Whether I am just sobbing or whether I am talking about my feelings, they're there to listen, and they're there to be there. And they really don't have to say anything. I've had, multiple times where I'm hanging out with friends and I've just said, I really want to be in the moment and I really want to have this great experience, but I'm just feeling so much. I'm feeling a lot of emotions about my loss, and it comes out of nowhere. Grief doesn't have a timeline, and so there's been times where it's out of nowhere, super random, and I just tell my friends, like, I'm having a hard time right now, and it's just so nice to be open and to be supported. Another thing that has been so helpful is just openly talking about it. Of course, you're going to tell the people that are close to you, and that is great. Those people can support you. But I think there's also something to be said about telling people that maybe even aren't that close to you. I know for me, I've got my really close group of friends, and then I have what I call like my mom friends, and we hang out for play dates, and we get the kids together and we see each other at preschool drop-offs. And even with those friends who I really am not super close with, I've still mentioned my miscarriage because, first of all, 1 in 4 women have miscarriages. And the amount of times that I've mentioned what I've experienced, there's often always at least one other woman that has said me too. And just finding solidarity and support in something that is not really talked about is so helpful. And it really opens the doors to connect with somebody else who has had a similar experience. So just being open about it, with your outer circle, not just your inner circle. Another thing that really helped me along the same lines of, looking at career and jobs and all of that, I did not push myself. As a real estate agent, it can be very stressful, and I decided to put a pause on real estate as much as I could and become a part-time preschool teacher at my daughter's preschool. And that was a really great opportunity, and I was really lucky to get that opportunity because I was able to kind of go back to what I've done most of my life. I've worked in education, I worked in preschools, and it's just a very comfortable setting for me, comfortable work environment. And there's really no pressure. It's not a difficult job for me to jump into. And so it was really great to pause the harder parts of my career and just focus on something that was easy and doable, and I didn't have to push myself. And I know that that is obviously not an option for everybody, but if there's different areas in your life where you feel like there's a lot of pressure, there's a lot of expectation, and you can rework or rearrange or deprioritize that, I would highly suggest that because it can be really, really great. Just being able to focus on healing and focus on family rather than the pressure you feel from, whether it's a job or a hobby or whatever it is. And the thing that has made the most difference in my healing journey is hands down antidepressants. I think it must have been a week after I miscarried that I reached out to my doctor and I said, I need something. Like I cannot live like this. And I've struggled with depression for, I feel like, a lot of my life. But for the most part, it has mostly felt annoying. It, feels annoying to be less motivated, to be extra tired, to feel sad and to feel hopeless, because I know that it will pass. And it's just waiting for it to pass. And for me, it has just felt annoying for the most part. And so I just realized after I miscarried this last time that this was much, much more than that. I wasn't annoyed. I was so lost in grief that I didn't want to get better or feel better. I didn't want it because in the grief is where I felt close to the child that I lost. And getting on antidepressants, I knew that I needed to do something different because just to continue living my life, to be a mom to my daughter, to be a partner to my husband, to work, I could not do it without antidepressants. It's really hard to do anything when all you can think about is your loss. And so I got on antidepressants about a week after I miscarried, and within the first 24 hours, there was such a difference. it is absolutely mind-blowing what I've experienced. And I'm still taking my antidepressants, and it has been a very easy adjustment. I've thought about the antidepressants for a couple years now, you know, if it would be a good fit for me, but I was really afraid of the side effects. You know, I thought that I would feel numb. I thought that it would just affect my life in so many different ways, and that has not been the case at all. I feel alive. I feel so much more alive. And oh man, I feel like my best day not on antidepressants, pre-miscarriage, you know, even before my last miscarriage, my best day before antidepressants is about my baseline now. And so I just encourage anyone and everyone, and especially for those of us that have experienced a loss, to give antidepressants a try. I think that it really is life-changing, and there is so much stigma to taking medication, but mental health is health. It is no different than getting medicine for asthma or diabetes or allergies. You know, it's these are chronic conditions that we live with, and if there is a tiny little pill that is going to make me function better for myself and for my family, sign me up. Absolutely.
Okay. So after that, we do have Carmen Escobar here right now, and she would like to share a little closing statement from Karrie.
Hi, everyone. My name is Carmen Escobar, and I am Karrie's mom. I am the regional breastfeeding liaison for Tulare and Kings County. Karrie's working 2 jobs, and she's also volunteers at her daughter's preschool as well. So I'm grateful that she was able to make time to share and to tell us her story. Karrie has found that sharing her story has been part of her healing process, and wants to create a space for parents to share their story, whether at a play date, a coffee meetup, or hiking. I'm very proud of my daughter. Sorry. I didn't think I was going to cry, but I'm very proud of her for sharing her story. I'm very proud of my daughter for sharing her personal story, and so appreciative of her husband now, Troy. I'm sorry. His name is Troy, and all her friends who supported her through this hardship. Karrie didn't have time to make a closing statement video, but she sent me this statement to share with her for you this morning. She said, "Please tell everyone I am thankful you are openly talking about this topic, and I have a space to tell my story. Thank you, everyone."
Thank you so much, Carmen. Really appreciate you also sharing and you know, lifting up your daughter like that. And you know, it is such a hard topic to talk about, and I feel like this is a topic that we, and please don't take this in the way it might sound, but I feel like we need to normalize this topic in society so it doesn't feel like families or individuals are suppressed to their thoughts and feelings, and they're feeling like they can't talk about this openly. And so I'm glad that she felt safe to share her story, and the fact that she's healing through her sharing her story. And that to me it seems like it will have a huge impact on other people. Like it helps others the more we share our own experiences and stories and tragedies and grief. And like, we're all human, and there's this idea in our head that things have to go from point A to point Z seamlessly, and that's just not life. So thank you, Carmen, for reaching out to your daughter and giving us the opportunity to hear her story. And I know that wasn't easy to kind of go through again, but again, it goes through like the grieving process, and the more we talk about it, and the more we feel like we can actually cope. And Liz, Krey, great presentation. Thank you so much for all of the great information in the resources, the books, the groups. I hope there's someone here that knows somebody that they can share these resources with, and even use these resources yourselves or with your patients or colleagues or whoever, family, friends that might need these resources. That's what they're there for. So please feel free to share this presentation, the recording. This is what it's here for, is to get this information, education out. And if there are topics, and I want to invite you all, like if there are topics, not limited to this topic, it could be this topic again. The committee that we work on, we think that there could be more to this, and we need to create a space for this topic. So, if there's a certain topic that you're interested, that you want us to talk about and have a presenter present, please feel free to share. If this is something that really interests you and you want more of how to support people that you work with, or you're friends with a family with, that you need this type of education support, maybe we can have a part 2 of this. So anyway, I just want to say thank you again, Liz, for your presentation, and thanks to the committee who helped put this all together. So we have time left for questions, and Liz, I don't know, I don't want to put you on the spot, but want to check in and see if there's anything else that you want to add before we change over and go to our questions.
No, just again, thank you to Carmen for that little closing statement. It is a difficult topic to talk about, and I'm definitely a passionate advocate in creating more narrative around it and allowing it to have its space that it needs to in our healthcare system. And as friends, just being a little bit more informed.
Awesome. Well, thank you very much. Okay, so I'm looking through the chat and I don't see questions, but I'm seeing several very supportive, encouraging words of kindness and gratitude. And thank you so much for this great feedback, everyone. Yeah, I hope everybody can see the chat, and if you can't, there's a couple of comments, thank you. It's difficult. We need to acknowledge the issues surrounding grief and loss. Thank you, Carmen and Karrie, for sharing. Definitely understand. Lots of gratitude to Karrie and Carmen. This was beautifully done. Thank you for the kindness and respect and compassion showed throughout. Thank you for that. Yeah, yes, and again, participants of this will have access to the recording. So in about a week or so, we'll send out the link to this video as well as the slides. And in the slides, there's those resources that Liz was referring to, along with the QR code that you can scan if you didn't have the opportunity to fill out the form for CEs. You can do that too. Oh, we do have a question. Oh, that was the question. Okay.
I see a question. Are there specific evidence-based medications usually prescribed? Are you asking about antidepressants, or what kind of medications are you asking That would absolutely be up to their medical doctor and their psychologist. That's outside of my realm of expertise. But things like Zoloft or things along those lines, just standard antidepressants, are usually what they start with. Unless you have a history and you've already tried some of those, then there might be something more niche. But that would be something that you'd have to talk to a psychologist about, because that's a little bit outside of my realm.
Thank you, Liz. We have another question from Daisy. The only question I currently have is I need to show proof that I was in this. Oh, I'm sorry. I didn't read it through before I, yeah, let me send, I'll put the link in the chat again. And when you complete this evaluation form here, which is separate from the evaluation, this form just proves that you attended today. And then we'll get that information. We'll send you out the certificate. So click on that link and you'll get that, fill out that form, and we'll send that out to you all. And I like these topic ideas. We're gonna save these and put them in our notes. Really appreciate that, Christina and Paula. Thank you. What about medical interventions for suppressing/stopping milk production?
Yes, there are some medications that nurses and doctors will give if the parent chooses not to pump any milk, and that will be between the care provider and the grieving parent. This can be given at any stage. So if they start pumping and decide that it's not for them, then they can give the medications to stop lactation. But as for like the specific ones, I'm not a nurse, so that again is a little bit outside of my scope, but there are definitely prescribed medications, and then there are also medications that you can get over the counter that do reduce milk supply, such as allergy medications. A lot of allergy medications have a side effect of reducing milk production. So we typically warn parents away from that, so that way they don't lose their milk. But if you are seeing someone who desperately needs milk to be gone and they are not able to seek their OB, then there's some allergy medications that can reduce milk supply. But again, that should definitely be a conversation between the doctor and the mom or parent.
Thanks, Liz. Good information. I have a couple of other questions. We do have time, so I'm going to read them off. And I'm really just so happy to see all the how helpful this has been for a lot of people with your comments. So thank you. Keep bringing them in because we enjoy seeing how this is helpful. From Stephanie, I get questions from moms about taking antidepressants while pregnant, such as Zoloft. Any educational resources I can refer these patients to?
There are. I don't have them on hand right now, but we can write this question down and I can answer it in the email when we send the recording, if that would be okay, Sarah. And I can I'll have the question typed out and I'll have some links for you. There are several that are safe while pregnant. Not safe, they have low risks while you're pregnant or breastfeeding. There are some that have higher risks, some that have lower risks. So that's something that I'll share in the email, if that's okay. I don't want to give false information.
I think that's perfect. What we can do too is go back and revisit these questions, and we can create an FAQ sheet and just send that out along with the slides and presentation.
Sure.
These are some really good questions. Another question is from Kimberly. I've had 2 miscarriages. Thank you for sharing that, Kimberly. Is it okay that I let the participant know, not telling my story, but to let them know they are not alone?
Yeah, I feel as though if you have experienced a loss like that and you're trying to connect with that participant, then it is appropriate to let them know that you have been in their shoes. But like you said, you don't want to go into your details or anything. Like maybe you could say like, oh, I've had 2 miscarriages and they were at similar points. I can remember how much it hurts, and then just like reflect it back onto them. that's perfectly acceptable and very can be very comforting to that participant. It's just you don't want to say, "Oh, I understand," because I went and like launch into your whole story. So relating to your participant or your patient is 100% okay and very encouraged. It's just you just want to make extra sure that you reflect it back to them and let them have that space to share it with you. That was a great question.
All right, and then there's a question, a general question about if anyone knows about any future training opportunities on the topic pregnancy while on antidepressants. I guess that's what you're asking, Stephanie. And so that might be a good topic to look into for other lunch and learns as well. And then there's a question about peppermint oil. Is it true that peppermint oil will help with reducing milk supply?
It is. It is a thing that we often warn parents against during the holidays. Having one candy cane or having peppermint flavored creamer in your coffee is not going to necessarily reduce your supply. But if you're using like a peppermint body wash all the time or peppermint lotion, or you drink peppermint tea all the time, or it's like if peppermint is a big part of your life, then it can have a negative impact on your milk supply. It really depends on the person, how much it'll impact it. It likely won't totally dry up your milk, but you will likely notice a reduction in your milk supply if you are around peppermint oil often. The same is also with sage and parsley. It's like all of the Thanksgiving herbs. So
of course,
yes. So having a serving of it's fine, but if you go to like house to house to house to house and you're just like eating all of it, then it might be a problem.
And that's good to know for people that are not trying to use their milk supply.
Yes, it is.
Yeah. And then Christina offered a link. A recording is available for from the National Center of Fertility Review and Prevention on bereavement support. So thank you very much, Christina, for sharing that. We'll include that in our notes to share that with everyone. There's the question that was sent to me directly. Do milk banks make it easier through the application process for grieving parents to donate?
It's the same application for anybody, regardless of the reason why you're looking to donate. So unfortunately, you do still have to go through the testing process to make sure you're not on any sort of drugs that they don't like, usually street drugs, and making sure like you're in a sound state of mind and all of that. Like they do have a screening process. It's not too cumbersome, but it could be a barrier to those who are already experiencing grief and have a lot of stress in their life. But after you're screened, it's usually pretty straightforward. But the screening process, I believe, is the same, regardless of the reason why you're trying to donate.
There's a comment in here to that banks often waive the minimum donation amount for lost parents. So that's interesting. Let's see. Yeah, lots of great comments. Is there a way, let's see. Okay, I think the questions are slowing down. Oh, one just popped in. How would you open up the discussion about milk suppression or the possibility of donating milk?
I would pitch it as an open-ended question. Have you thought about what you might want to do with your milk? Could be a great question. And then if they look at you like they don't even know if there was an option, then you can go into like, well, we have the option of donating, all those things. And if they have thought of it, then they will give you their answer one way or the other. But just opening up with the gentle, have you given any thought of what you want to do with your milk is a nice, soft opening.
That's well said. Okay, I don't see any other questions rolling in, but I will keep this open for a couple more minutes, and because we do have until 1 o'clock, but if I don't see anything else roll in about 2 minutes, we're just going to close it up at 12 12:50, 12:51. So with that said, we will call this concluded. And thank you all so much for your time today, joining us, especially for such a sensitive topic and something that we can always continue learning on and talking about. So thank you so much. Happy Valentine's Day again to everybody. Hope you get to spend time with your loved ones, and go enjoy your lunch if you haven't had it already. So thanks again.
Sarah.
Yes.
Hi, Sarah. This is Claudia. I just wanted to take an opportunity really quick on we work great, where the Kings County Breastfeeding Coalition and our Tulare County Breastfeeding Coalition have been working great for these lunch and learns. And we're also working together with other local Central Valley breastfeeding coalitions to bring an in-person breastfeeding conference, lactation conference, to the Central Valley. So we are so excited to be able to be in person and bring a quality lactation education to the Central Valley. I did put it into the chat box, so you have a registration flyer, and then there's also a direct link to the registration site. So, I know that we branched out. We have people outside of California, but also a big portion of the Central Valley when it comes to the lunch and learns. But there's also people throughout, California that are on there. So make it a trip. We'd love to host you. Come to the Central Valley. And I just wanted to take that opportunity, since we have these wonderful lactation advocates that are on line today that took time. I wanted to share that education opportunity.
Thank you so much, Claudia. I'm so glad that you brought that up. And what we'll do, because there's been people kind of falling off, so we'll just include this in with all the rest of the resources, the slides, the presentation, the FAQs, and then the registration flyer along with the link. So if you have any questions, you can always email us at kcbc.tcbc@gmail.com, and we'll try to reply to you as soon as possible. So any last comments or questions from the committee?
No,
okay. All right, and I don't see any other questions, so we'll close up. Thank you all so very much. Have a great day.